What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, such as myself, I hope you have a full and speedy recovery with no long COVID issues. It is time now for a Monday edition of the virus update for Monday, December 30th, 2024. That's right, I thought we would do a virus update today. As you just saw, yes, I did test positive once again, and yes, it came up positive right away. It did not hesitate to say, oh, nope, I'm still positive. And before we do get into any virus update today, quick update on my symptoms. In case you did not know, I first tested positive for COVID on Saturday. I started feeling a sore throat on Friday night, a little bit of a runny nose, and then late Friday night, all suddenly I was like, whoa, what's this? I woke up, I was shaking with chills, and then I had a fever a few minutes later. I was like, okay, this is not normal. Then the next morning, my throat was still messed up. All those things were still happening. I said, you know what? I'm going to take a COVID test. And that's when on the 28th, which was Saturday, I took this COVID test right here. It came up positive. And I was like, okay, I'm positive for COVID. Then a friend helped me show me a website where I can get Paxlovid. I got Paxlovid real quickly. And then pretty much Saturday was a really bad day. Yesterday I was just really low energy, having coughing fits from time to time. Luckily the coughing fits have gotten better today. We're going to try and get through this without a coughing fit. And low energy, headaches, pain. Walking around, I'm very slow when I'm walking around right now. And that's pretty much the way it is today, but less coughing fits, but just in a lot of pain. If you have any spot that was giving you pain before COVID, yeah, COVID really brings it out of you, or at least for me. It's really bringing it out in spots I never even knew I had pain. Sometimes it's in my arms, sometimes it's in my legs. It's just really strange. And then, of course, this headache will just not go away whatsoever. And I am on Paxlovid, which I do believe is helping me to a degree. And overall, I would say from Saturday to today, that's an improvement. From yesterday to today, a slight improvement. But again, this headache, it just continues on. And I'm also having trouble sleeping at night. I didn't sleep very much last night or the night before, for that matter. I only slept just a few hours, and it was like, okay, I'm wide awake. But at the same time, I'm low on energy. I just don't feel like getting up to do much of anything. So that's where I stand with COVID. And if you tested positive, well, I hope you have a full and speedy recovery. Once again, yep, right away, I came up positive. All right, I just thought we would run through a few news stories today. I actually had a full update planned for you guys on Saturdays. I never took down those news stories. And in fact, I just added a few more things that I found today. We're just going to quickly go through some of them, because there's quite a few things up here. We're not going to go through all of them. Then we'll go through some local stuff around here of what I'm hearing on social media, and what I'm seeing on CAD is just totally ridiculous right now. And then we're going to look at wastewater, because that's ridiculous as well, and Walgreens did update today. So we're not going to make this too long of an update, because I want to really try and reserve my energy. Some are probably mad that I'm doing a full update, but we're going to do that today. Oh, real quickly, just got this in the mail today. Actually ordered this before I tested positive for COVID. It was slated to come today, and not happy with Amazon on this. Amazon actually, the box came damaged, but got a new shipment of masks in today. Yep, whole new box of 50 N95s just came in today. Here's a brand new one. I thought we would do the video without a mask on today. I do have an air purifier running behind me. My door is closed. Some people have been commenting, saying, oh, well, you're in the room by yourself, the mask on. Okay, the point is I'm trying to keep others safe. That's why I was wearing a mask. But at the same time, yes, I am in a room by myself. Hopefully no one else in my house gets infected. Knock on wood, has not happened yet. I'm concerned it could happen, though, but we'll see. All right, starting off with just a few news stories. Flu activity is surging again in Alabama, reaching high levels. We're just quickly going to go through some headlines here. Louisiana flu activity cases among the highest in the country. And take a look at that. The old purple, Barney color, is showing up there in Louisiana. It's also showing up in Oregon as well. That's really bad. Moving on to this now. Hospital in South Wales introduced mask-wearing rules amid fears of rising flu cases. So flu over there is really bad, and we know whatever's happening over there, at least some of the times with some of these viruses, sometimes leads to bad things happening over here. There's a disconnect now with COVID, but flu, that may actually be the case. And, I just saw a post on Facebook earlier on my timeline. Someone I went to high school with. And I just happened to see, this many years ago I went to high school, but hospital with the flu and pneumonia at the same time. So sad. Double infections. Everyone thinks, oh, well, if you get COVID or this or that, you're fine. No, think about this. There's a lot of viruses running around right now. You can get double and, well, heck, maybe even triple infections. You can get more than one virus at once. Be super careful. Now moving on to this one. CDC respiratory illness activity high nationally. Who could have guessed that would have happened around the holidays? You think, well, maybe I shouldn't even say this. You think the president or someone would have come on ahead of the holidays and said, hey, viruses are starting to get high right now. Think about taking precautions during the holiday. Of course, no one would have taken it seriously. All right, just quickly moving on here. Flu-like symptoms at very high levels across Tennessee, according to the CDC. Moving on to, no, that's not what we want to see. Here we go. A dangerous, extremely contagious illness spreading rapidly across New York. Yes, apparently there is an illness, a case of a serious bacterial illness that is especially dangerous to infants is quickly rising across New York State. We've heard about something like this happening before there. Well, it's happening once again. The Archbishop of Albania is hospitalized with a, quote, seasonal illness. Just seasonal. Whatever that's supposed to mean. Did not see much in the way of details when it comes to that. Taking a look at the viral activity level today in Canada. Let's see where that is at. And moderate for COVID. Flu A is moderate. Flu B is low at this time. And RSV is running high at this time. All right, taking a look at Philadelphia. We have to go back a few days here. In Philadelphia, there were 901 EMS incidents on Friday. That number was lower on Saturday, 784. And then on Sunday was also 784. And you're noticing a theme here. 784 fire incidents. Yeah, so something is clearly wrong there. They clearly posted the Saturday numbers and just labeled it Sunday by mistake. I don't know. Maybe they will correct themselves. All right, let's do a live looking at what's going on in the surrounding counties in Philadelphia. I'm happy to report Montgomery County is, while 13 calls, you may think that's a lot of calls. It was above 15 calls from 8 a.m. all the way up to about 3 o'clock, and at times it was going over 20. Let's take a look at what's going on in Chester County, Pennsylvania. I hope that's gone. No, it hasn't. Chester County, Pennsylvania has been very busy all day, and you'll see in just a moment, all these calls is reflecting on the hospital situation in eastern Pennsylvania. There really is a big problem going on in eastern Pennsylvania. Look at this. 1, 2, 3 respiratory calls, multiple stroke calls. Actually, no, 4 respiratory calls. Heart problems is showing up. Yeah, there are a lot of calls at this. Actually, wait a second. 1, 2, 3, 4. Yeah, 4 respiratory calls at this time in Chester County, Pennsylvania. So, yeah, very busy for that. Drum roll, please. Wait till I show you this. The hospital situation, Pennsylvania. And actually, this looks a little bit better than it did when I looked at it 20 minutes ago. Pretty sure there were a few more yellow hospitals listed in central Pennsylvania, but nonetheless, let's count how many there are, because every yellow hospital has some sort of an issue going on, whether it be a full divert, behavior health, stroke, patient volume, or something. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Did I get that correctly? I don't know. That's a lot of hospitals that are dealing with problems, and now some of these could be outdated information, but this one, Sometimes we click on it, Bryn Mawr Hospital. No, that's not outdated. And look what it's saying here. It is saying high patient volume. And look at this. We come down here to Upper Darby, Pennsylvania. High patient volume, and that is for today's date. Take a look at this one. Now this one, Crozier Chester Medical Center, that's coming up as the 28th, so that is outdated information. Chester County Hospital, Penn Medicine, that is coming up as emergency department, overcrowding. 11 inpatient boarders. I'm not 100% certain what that means. Could that mean that there's 11 patients sitting in the hallways? I honestly don't know. If anyone knows what that means, maybe they know a thing or two about hospital diverts more than I do, let me know down below what that means. Moving on now to New Jersey, and take a look at this. Virtual Mount Holly is doing a vert for patient volume. The Valley Hospital is doing an adult emergency department. Is having a patient volume. And wow, yeah, there's a lot of hospitals in New Jersey with problems as well. We can see RWJ University Hospital, patient volume. University Hospital Hamilton is having patient volume. Wow. RWJBH Community Medical Center, patient volume. Penn Medicine Princeton Medical Center is having a patient volume issue. Inspire Mulca Hill is having patient volume. Ocean University Medical Center is having patient volume. Cooper University, patient volume. Central State Medical Center, patient volume. Chilton, I hope I'm saying this correctly. Apologies, my voice is just absolutely horrible right now. Chilton Medical Center, patient volume. Wow, how many hospitals is this? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 hospitals in New Jersey are diverting. And before someone tells me, oh, well, there's over 70 hospitals. Okay, 12 hospitals is pretty bad. That's the most we've ever seen in one of my virus update videos since we started using this dashboard out of New Jersey. All right, Walgreens had the new update today. The national positivity rate from Walgreens was 16.6%. This is for COVID. And the prior week was 15.5%. Difference of up 1.1%. Total tests, 7,000. The prior week is 6,934. I believe that's the most testing since back in October. But I do want to draw your attention to something. And a few people will probably say that I need to show this. And it's true, I do. And this is a very important point. But I'm also going to bring up another point in just a second. Take a look at the positivity level. There's where we are on the 29th of this year, 16.6%. Look where we were. Oh, where do I want to go with this? Last year, in December. Much lower. And the years before, and the years before. But again, with so many viruses running rampant, you can get double infections of these viruses. And I'm not just seeing it on Facebook. I'm hearing about it on X postings and other places as well. It is happening. So please be careful. Maybe you get hospitalized for one virus, and while you're in the hospital, you pick up another virus. It is a real problem. Let's just click on a few states because I then want to show you wastewater, New York State, and then that's it for today. All right, Maine's positivity rate is clearly bouncing around a lot. 31.3%. Seems to me as if they're having a problem with something there when it comes to testing. It just goes up, down, up, down, up, down. Pennsylvania's positivity rate, 23.3%. That is up by 1.7%. Michigan's positivity rate, oh my, 32.9%. Prior week was 27%. That's up by 5.9%. And as we know, the Midwest has been getting hit hard. Testing is up 158 versus 137. Oklahoma, state with one of the highest long COVID rates, 23.9%. The prior week is 11.7%. Difference of up 12.2%. And let's end on a good note. California, it's just not rising there because you got hit oh so hard in the summertime. California's positivity rate is 10.8%. Prior week is 13.4%. Difference of down 2.6%. Total tests, 212 versus 246. Now, I say it's not rising there. It's not rising there on Walgreens. We'll see what California reports when they update again later this week. And mind you, other viruses are not going so great in California. We'll look at some more Walgreens states next time. All right, now I have to show this to you, and this was one of the reasons why I was just itching to do a video today. And there's a few things here that you need to see. First off, I get it. This is Wastewater Scan. It's Monday. A lot of people are going to say, well, on Mondays, sometimes that has to be corrected later in the week. True. You're correct. But there's something within here that's not COVID that I want to show you that trust me, even if it corrects on Wednesday, Thursday, or Friday, it's still going to be way higher than previous years. First off, COVID. COVID is continuing to rise here, and multiple updates show COVID nationally in the United States is rising quickly. RSV, yes, that's rising quickly. Influenza A is really rising at this time, so again, following much like the UK, Influenza B is low, HMPV is low, but now step aside and let's take a look at what's going on with norovirus, if we may for just a moment, and I do want you to see this. And let me zoom this out. Yeah, take a look here. Norovirus. It's the highest ever reported on the Wastewater Scan dashboard. Now, I really wish we could go back 10 years in time to see how this compares to pre-COVID times or to some other random year that may have been high. But norovirus. Now, here's the wonky movement at the end right here. Okay, so let's just forget about that and stop right there. Follow my pointer here, my mouse. Yeah, it's still higher than all these other years. Norovirus is absolutely through the roof right now, which is terribly, terribly concerning. Let's go back to the national map here, and let's just take a look at the regions real quickly. The Midwest region, yeah, you're still rising for COVID. RSV is running really high. Influenza A. So you're seeing all these viruses. Take a look at norovirus in the Midwest. You're seeing all these different viruses, and mind you, pneumonia is not on here either. That's running high as well. You're seeing all these different viruses that are running high. That's why I'm saying, if you have to seek health care, or if you're out and about, it is very easy right now to catch more than one virus at once. A lot of people are doing just that, and it can become a scary situation pretty fast. The Northeast, COVID continues to rise. The wonky movement was downward, so yeah, the Northeast is quickly rising. RSV is high in the Northeast. The good news is some of these viruses, maybe within a week or two, should start to peak. Norovirus is high. Flu is running high in the Northeast. Wow, look at that. Flu A level. And speaking of flu, I got to tell you, I'm impressed. Yes, I was aware and saw bird flu is making its rounds in the news. The media is starting to take this seriously. Is it because there's a new administration coming into the White House? I don't know, but they are at least starting to give it more mention on TV. Leave your theory about that down below. In the South, it looks like COVID maybe has peaked. RSV maybe has peaked. Influenza A is still rising. Norovirus is still high. And lastly, the West Coast at this time is still running high at this time. COVID does show up that it's rising here. RSV is rising. You get the idea. Everything is high here. All right. Ending today with New York State. 1,266 new cases on the most recent update. And taking a look here, hospitalizations. They did jump up to 655. In the ICU, 54. The wild card remains for this holiday season, or the start of the new year, which is coming very soon. Will New York State go over 1,000 hospitalizations? We'll see. It is possible they may not do that for COVID this year, but at the same time, they're probably getting hit very hard in the hospitals with all these other viruses. Alrighty, folks, that does it for today's virus update. Wow, look at that. I went 19 minutes without coughing. Rather impressive, but now my voice is getting very tired. I probably overdid it here, but that's okay. You guys deserved an update today. I'm going to take a rest now, and that's it. If you enjoyed this video, thumbs up, subscribe down below, notification bell, share this with anyone you know, and of course, leave your comments down below. I'll see you all again next time. Till I see you again next time, have a fantastic Monday, and thanks for watching. Please be safe out there. Please try and stay healthy and don't become COVID positive like me. Have a fantastic day.